Welcome to our new playlist that is the Nutter's Anatomy Flashcards. In this book, we will discuss the flashcards and each card we will discuss per lecture. So let's start. It's very important to know the each term and basic terminologies in this great book. We have 7 sections in this book. Here is the table of contents. First section is the head and neck. Second, we have back and spinal cord. We will discuss each and every details of the head and neck, the bones, muscles, joints, their origin, insertion, all things in detail. This is very amazing playlist. I really like this. Section 3 is the thorax. 4 we have abdomen. Then we go for pelvis and perineum. We will discuss each part in detail and you will able to identify each thing in your dissection hall. This is very important for first year, second year medical students and even graduates, they who forget the basic things. Then we will go for upper limb and the lower limb. This playlist is going to be very amazing. So let's start. First, as I told you, we discuss each card in each lecture. Head and neck. First we go for joints, bones and joints of a head and neck, and in this lecture we will discuss the skull and have skull anterior view. Then we go for further these series in detail step by step. Skull, then we go for lateral view, mid-sagittal section, lateral wall of nasal cavity, inferior view, and all these things we will discuss in detail. So here, this is our first lecture. We will discuss this page in today's lecture. Just skull anterior view. These are the labels that you can see 1 to 10, and we will discuss the what is the structure name of a 1 2 3 4. You can become master of the things. We have now have bones and joints. This is the first label, that is the 1. What is this? This is our frontal bone. This is called frontal bone, and the label 2 you can see, this is the notch. This is called, it is above the eye, so it is the supraorbital notch or supraorbital foramen. It is above the foramen. You can see. First we have frontal bone. Second label is supraorbital notch, and the third thing you can see here is the orange. This is the nasal bone, bone of the nose. And the fourth label you can see here in the purple, small. This is the lacrimal bone. The fifth label you can see, this is the zygomatic bone. We covered half labels. First we have a frontal bone. It's very easy to remember. This is the front, so this is the frontal bone. Second we have a supraorbital notch. The third thing is nasal bone. Fourth one is the lacrimal bone. The fifth is the zygomatic bone. So I think I am completely sure that you remember all of these. Next we will discuss the sixth. You can see this is the infraorbital foramen or infraorbital notch. This is on the above. This is the supra, and the inferior, this is the infraorbital notch. Very easy to remember. And the seventh label, this is the maxilla. This is the maxilla bone. Here you can see attach the upper teeth. The 8 label, where is 8? This is Eighth level is the mental foramen. This is the foramen. Foramen means hole. This is the mental foramen. And the ninth level is the mandibular bone. This is the maxilla. Seventh and nine is the mandibular bone. Ninth where the lower teeth attach. And the last we have a temporal bone. 10th, this you can see in the red label, this is the temporal bone. So we completed the skull anterior view and it's very easy. So next we will discuss what is written here. The skull bone are fused together at immovable fibrous joints such as sutures. Skull bones are fused together with the aid of sutures. Sutures are the example of fibrous joint. Okay, it's important to remember for MCQs. The two general classes of skull bones are the cranial bones that are 8 in number, which includes the brain, and facial bones which are 14 in number. So there are 22 almost bones in the skull. The 8 cranial bones are frontal bone, occipital, ethmoidal, syphnoidal bone, and the pair, because the temporal bones are 2 on one side and on the other side. Temporal bones are in pair, and the pair of parietal bones. Next, you can see associated bones of the skull include the auditory ossicles. It is present in the ear. 3 is in each middle ear. It means these are 6 in number. The skull and associated bones collectively 26 different bones. The 32 adult teeth are the part of maxilla and mandible. As I told you, maxilla, this where the upper teeth attach, and the mandible where the lower teeth attach, and are not counted separately. These are not counted separately, and the total different associated bones in the skull is 26. I hope so. Yeah, this will clear all the 10 labels, and the information about skull is clear. Next, we will discuss the clinical. This playlist is very important. As I told you before, we also go for clinical here. Mid-face fracture are classified clinically as Lee-Fault fractures. The mid-face, if the fracture of the mid-face, it is classified as Lee-Fault fracture, and it has 3 stages are called as or according to its severity. In the grade 1, Lee-Fault 1, horizontal fracture, detach the maxilla along the nasal floor, and in the 2, moderate fracture, you can call it perimetal fracture, that includes both maxilla, nasal bone, infraorbital rims, and the orbital floors. And the third one, it is more severe. It includes the Lee-Fault 2 fractures, all things, and both zygomatic bones may cause airway obstruction, nasolacrimal obstruction, and the CSF. What is CSF? Cerebrospinal fluid, that is present in the brain and spinal cord, and it causes the leakage of the cerebrospinal fluid. This is the clinical we will discuss, and in this lecture we discuss in detail the skull anterior view. Very important playlist, so kindly subscribe the channel for more such amazing videos. Thank you.